Study guide for physical assessments, including key terms and their definitions. Cultural competence and health history assessment. Key terms: culture, ethnicity, race, religion, spirituality, cultural competency. Definition of key terms. O. Culture, the beliefs, values, practices, and behaviors shared by a group of people. O. Ethnicity, a social group that shares a common cultural heritage, such as language, religion, or history. O. Race, a social construct that categorizes people based on physical characteristics such as skin color, hair texture, and facial features. O. Religion, a system of beliefs, practices, and values related to the worship of a higher power. O. Spirituality, a sense of connection to something greater than oneself, often related to a search for meaning or purpose in life. O. Cultural competency, the ability to understand, appreciate, and effectively interact with people from diverse cultural backgrounds. Assessment techniques, collecting a comprehensive health history, including information about the patient's cultural background and health beliefs. Mental status assessment. Key terms: consciousness, orientation, attention, memory, language, abstraction, judgment, affect, mood. Definition of key terms. O. Consciousness, the state of being aware of one's surroundings and able to respond to stimuli. O. Orientation, awareness of one's surroundings, including time, place, and person. O. Attention, the ability to focus on a task or stimulus. O. Memory, the ability to recall information. O. Language, the ability to understand and use spoken and written words. O. Abstraction, the ability to think conceptually and understand abstract ideas. O. Judgment, the ability to make decisions based on logical reasoning. O. Affect, the emotional expression or tone conveyed through facial expressions, body language, and voice. O. Mood, the prevailing emotional state or feeling. Assessment techniques: observing the patient's appearance, behavior, speech, mood, and affect, and using standardized mental status tools to assess cognition, memory, and executive function. Pain assessment. Pain assessment is a vital part of any patient evaluation, as pain can significantly impact a person's quality of life and ability to function. Proper pain assessment is necessary to identify the source and severity of pain and develop an appropriate treatment plan. Key terms: acute pain, chronic pain, breakthrough pain, neuropathic pain, nociceptive pain. Acute pain, pain that is short-term and typically caused by injury, surgery, or illness. Chronic pain, pain that persists for an extended period, usually 3 to 6 months or more. Breakthrough pain, episodes of severe pain that occur despite ongoing pain management. Neuropathic pain, pain caused by damage or dysfunction in the nervous system. Nociceptive pain, pain caused by damage or inflammation to tissues or organs. Assessment techniques. Self-report, the most reliable method of pain assessment, which involves asking the patient to describe their pain using a pain scale or verbal description. Observation, assessing for physical signs of pain, such as grimacing or guarding. Behavioral assessment, assessing for changes in behavior, such as decreased activity or increased agitation. Physical examination, assessing for areas of tenderness, swelling, or other signs of injury or inflammation. A comprehensive pain assessment should consider the nature and location of the pain, its intensity and duration, and any associated symptoms or factors that may influence the pain, such as stress or anxiety. A healthcare provider should use the information gathered during the assessment to develop an appropriate treatment plan that addresses the underlying cause of the pain and provides effective pain management. Nutritional assessment. Key terms: macronutrients, micronutrients, malnutrition, obesity, body mass index, BMI. Definition of key terms. O. Macronutrients, nutrients that the body needs in large amounts, including carbohydrates, proteins, and fats. O. Micronutrients, nutrients that the body needs in smaller amounts, including vitamins and minerals. O. Malnutrition, a condition resulting from a lack of nutrients, excess nutrient intake, or an imbalance of nutrients. O. Obesity, a medical condition characterized by excessive body fat that increases the risk of health problems. O. Body mass index, BMI, a measure of body fat based on height and weight. Assessment techniques, asking about the patient's dietary habits and intake, performing a physical examination to assess for signs of malnutrition or obesity, and using tools such as BMI to assess weight status. Skin, hair, and nails assessment. Key terms: pallor, erythema, cyanosis, jaundice, macule, papule, vesicle, bulla, pustule, plaque, scale, crust, erosion, ulcer, fissure, excoriation. Definition of key terms. O. Pallor, pale or white skin color. O. Erythema, redness or inflammation of the skin. O. Cyanosis, blue or purple discoloration of the skin due to lack of oxygen. O. Jaundice, yellowing of the skin and eyes due to excess bilirubin in the blood. O. Macule, a flat, non-palpable lesion less than 1 cm in size, such as a freckle or mole. O. Papule, a raised, palpable lesion less than 1 cm in size, such as a pimple or wart. O. Vesicle, a small, fluid-filled blister less than 1 cm in size. O. Bulla, a large, fluid-filled blister more than 1 cm in size. O. Pustule, a small, pus-filled lesion. O. Plaque, a raised, flat-topped lesion more than 1 cm in size. O. Scale, a flaky, dry, or greasy buildup of dead skin cells. O. Crust, a dried exudate, such as blood or pus, that forms on the skin. O. Erosion, a shallow, moist lesion that does not extend through the dermis. O. Ulcer, a deeper, open lesion that extends through the dermis and may involve tissue loss. O. Fissure, a linear crack or groove in the skin. O. Excoriation, a scratch or abrasion on the skin. Assessment techniques, inspecting and palpating the skin, hair, and nails for color, texture, moisture, temperature, and lesions. Head and neck assessment. Key terms: headache, dizziness, vertigo, syncope, concussion, laceration, abrasion, contusion, hematoma, lymphadenopathy, thyroid gland enlargement, bruit. Definition of key terms. O. Headache, a pain or discomfort in the head or neck region. O. Dizziness, a sensation of lightheadedness or unsteadiness. O. Vertigo, a spinning sensation. O. Syncope, a temporary loss of consciousness due to decreased blood flow to the brain. O. Concussion, a brain injury caused by a blow to the head or body that results in temporary or permanent impairment of brain function. O. Laceration, a deep cut or tear in the skin. Abrasion, a superficial wound caused by rubbing or scraping the skin. Contusion, a bruise caused by blunt force trauma that results in bleeding under the skin. Hematoma, a localized swelling filled with blood. Lymphadenopathy, swollen lymph nodes. Thyroid gland enlargement, a swelling or enlargement of the thyroid gland in the neck. Bruit, an abnormal sound heard over an artery or other blood vessel. Assessment techniques, inspecting and palpating the head and neck for symmetry, masses, and tenderness, assessing the cranial nerves, and performing special tests such as the Romberg test to assess for balance. Eyes assessment. Key terms: visual acuity, presbyopia, myopia, hyperopia, astigmatism, strabismus, nystagmus, diplopia, exophthalmos, enophthalmos, ptosis, conjunctivitis, sclerolicterus. Definition of key terms. O. Visual acuity, the sharpness or clarity of vision. O. Presbyopia, the age-related loss of near vision. O. Myopia, nearsightedness, or difficulty seeing objects at a distance. O. Hyperopia, farsightedness, or difficulty seeing objects up close. O. Astigmatism, a refractive error caused by an irregularly shaped cornea or lens. O. Strabismus, a misalignment of the eyes. O. Nystagmus, involuntary eye movements. O. Diplopia, double vision. O. Exophthalmos, bulging of the eyes. O. Enophthalmos, sunken appearance of the eyes. O. Ptosis, drooping of the eyelid. O. Conjunctivitis, inflammation of the conjunctiva, or the clear membrane that covers the white part of the eye. O. Sclerolicterus, yellowing of the sclera, or the white part of the eye, due to excess bilirubin in the blood. Assessment techniques: assessing visual acuity, inspecting the external eye structures and eyelids for symmetry and inflammation, assessing for extraocular movements and alignment, and examining the internal eye structures with an ophthalmoscope. Ears assessment. Key terms: otalgia, otorrhea, tinnitus, vertigo, hearing loss, presbycusis, cerumen, otitis media, otitis externa, mastoiditis. Definition of key terms. O. Otalgia, ear pain. O. Otorrhea, discharge from the ear. O. Tinnitus, ringing or buzzing in the ears. O. Vertigo, a spinning sensation. O. Hearing loss, a decrease in hearing ability. O. Presbycusis, age-related hearing loss. O. Cerumen, earwax. O. Otitis media, infection of the middle ear. O. Otitis externa, infection of the outer ear canal. O. Mastoiditis, infection of the mastoid bone behind the ear. Assessment techniques: inspecting and palpating the external ear structures for symmetry and tenderness, assessing hearing acuity and identifying any hearing loss or tinnitus, and performing the Weber and Rinne tests to assess for conductive and sensorineural hearing loss. Nose, mouth, and throat assessment. Key terms: epistaxis, rhinorrhea, nasal congestion, allergic rhinitis, sinusitis, sore throat, pharyngitis, tonsillitis, laryngitis, dysphonia, dysphagia. Definition of key terms. O. Epistaxis, bleeding from the nose. O. Rhinorrhea, excessive nasal discharge. O. Nasal congestion, blockage of the nasal passages. O. Allergic rhinitis, inflammation of the nasal passages due to an allergic reaction. O. Sinusitis, inflammation of the sinuses. O. Sore throat, pain or discomfort in the throat. O. Pharyngitis, inflammation of the pharynx. O. Tonsillitis, inflammation of the tonsils. O. Laryngitis, inflammation of the larynx. O. Dysphonia, hoarseness or difficulty speaking. O. Dysphagia, difficulty swallowing. Assessment techniques. O. Nose, inspecting the external nose for deformities, palpating the sinuses for tenderness, and assessing for nasal discharge, congestion, and epistaxis. O. Mouth and throat, inspecting the mouth and throat for abnormalities, assessing for tonsillar enlargement, and assessing for pharyngeal inflammation. The assessment also includes checking the uvula's position and movement, inspecting the vocal cords for dysphonia, and assessing for difficulty swallowing. Note: the nose, mouth, and throat assessment is essential in identifying various upper respiratory conditions, such as sinusitis, pharyngitis, and laryngitis. These conditions can result in significant discomfort and impact a patient's quality of life if not addressed and treated promptly. Additionally, the assessment can help identify more severe conditions such as oral cancer and tonsil cancer, which require timely intervention for optimal outcomes. Mouth and throat assessment. Key terms: aphthous ulcers, stomatitis, gingivitis, periodontitis, leukoplakia, candidiasis, tonsillitis, pharyngitis, laryngitis, dysphagia. Definition of key terms. O. Aphthous ulcers, small, painful sores in the mouth. O. Stomatitis, inflammation of the mouth. O. Gingivitis, inflammation of the gums. O. Periodontitis, inflammation of the tissues surrounding and supporting the teeth. O. Leukoplakia, thick, white patches on the inside of the mouth or on the tongue. O. Candidiasis, a fungal infection of the mouth. O. Tonsillitis, inflammation of the tonsils. O. Pharyngitis, inflammation of the pharynx. O. Laryngitis, inflammation of the larynx. O. Dysphagia, difficulty swallowing. Assessment techniques: inspecting and palpating the lips, oral mucosa, tongue, gums, and tonsils for abnormalities, assessing for the presence of lesions, and assessing for swallowing difficulties. Thorax and lungs assessment. Key terms: adventitious breath sounds, wheezing, crackles, stridor, pleural friction rub, dyspnea, orthopnea, hypoxemia, hypoxia, cyanosis. Definition of key terms. O. Adventitious breath sounds, abnormal breath sounds heard during auscultation of the lungs. O. Wheezing, a high-pitched whistling sound during breathing. O. Crackles, short, interrupted, and non-musical sounds heard during breathing. O. Stridor, a high-pitched, harsh sound heard during inspiration. O. Pleural friction rub, a creaking or grating sound heard during respiration due to inflammation of the pleural lining. O. Dyspnea, shortness of breath. O. Orthopnea, shortness of breath when lying down. O. Hypoxemia, low levels of oxygen in the blood. O. Hypoxia, insufficient oxygen supply to the body tissues. O. Cyanosis, bluish discoloration of the skin and mucous membranes due to decreased oxygenation. Assessment techniques: assessing the respiratory rate, depth, and rhythm, auscultating breath sounds, palpating for chest expansion and tenderness, and assessing for signs of hypoxemia such as cyanosis. Cardiovascular system assessment. Key terms: palpitations, chest pain, shortness of breath, edema, orthopnea, paroxysmal nocturnal dyspnea, peripheral artery disease, venous thrombosis. Definition of key terms. O. Palpitations, a sensation of rapid or irregular heartbeats. O. Chest pain, a discomfort or pain in the chest, which can be caused by various cardiovascular conditions. O. Shortness of breath, difficulty breathing, often described as a feeling of breathlessness or suffocation. O. Edema, swelling caused by the accumulation of fluid in tissues. O. Orthopnea, difficulty breathing while lying flat, often relieved by sitting up or standing. O. Paroxysmal nocturnal dyspnea, sudden onset of difficulty breathing during sleep, often causing the person to wake up gasping for air. O. Peripheral artery disease, a condition in which the arteries that supply blood to the limbs become narrowed or blocked, leading to decreased blood flow to the affected area. O. Venous thrombosis, a blood clot that forms within a vein, often in the legs or arms. Assessment techniques. O. Inspection, observing for any visible abnormalities, such as chest deformities or distended neck veins. O. Palpation, feeling for any pulsations, heaves, or thrills, which can indicate abnormal heartbeats or structural abnormalities of the heart. O. Percussion, assessing for any dullness or resonance over the heart, which can indicate fluid accumulation. O. Auscultation, listening to the heart sounds, including S1, S2, and any abnormal sounds, such as gallops or murmurs. O. Assessment of peripheral pulses, feeling for any weak or absent pulses, which can indicate peripheral artery disease. O. Assessment of the legs, looking for any signs of edema, tenderness, or redness, which can indicate venous thrombosis. Note: the cardiovascular system assessment is crucial in identifying various cardiovascular conditions such as heart disease, peripheral artery disease, and venous thrombosis. These conditions can have significant impacts on a patient's health and quality of life, and early detection and intervention can improve outcomes. The assessment should include a comprehensive evaluation of the patient's symptoms, such as chest pain, palpitations, or shortness of breath, and an examination of the heart and peripheral vessels to identify any abnormalities. Breasts and regional lymphatics assessment. Key terms: gynecomastia, mastitis, fibroadenoma, breast cancer, axillary lymph nodes, supraclavicular lymph nodes. Definition of key terms. O. Gynecomastia, enlargement of the breast tissue in males. O. Mastitis, inflammation of the breast tissue, usually due to infection. O. Fibroadenoma, a benign breast tumor. O. Breast cancer, malignant tumor in the breast tissue. O. Axillary lymph nodes located in the armpit region. O. Supraclavicular lymph nodes located above the clavicle. Assessment techniques: inspecting and palpating the breasts for abnormalities, assessing for nipple discharge, assessing for axillary and supraclavicular lymph nodes, and teaching breast self-examination. Female genitalia assessment. Key terms: vulvitis, vaginitis, cervicitis, pelvic inflammatory disease, endometriosis, uterine prolapse, rectocele, cystocele, cervical cancer, uterine cancer, ovarian cancer. Definition of key terms. O. vulvitis, inflammation of the vulva. O. vaginitis, inflammation of the vagina. O. cervicitis, inflammation of the cervix. O. pelvic inflammatory disease, infection of the reproductive organs. O. endometriosis, growth of endometrial tissue outside of the uterus. O. uterine prolapse, protrusion of the uterus into the vagina. O. rectocele, protrusion of the rectum into the vagina. O. cystocele, protrusion of the bladder into the vagina. O. cervical cancer, malignant tumor of the cervix. O. uterine cancer, malignant tumor of the uterus. O. ovarian cancer, malignant tumor of the ovary. Assessment techniques: inspecting and palpating the external genitalia for abnormalities, inspecting the cervix with a speculum, assessing vaginal discharge, and performing a bimanual pelvic exam. Male genitalia assessment. Key terms: phimosis, paraphimosis, balanitis, epididymitis, orchitis, hydrocele, varicocele, testicular cancer, prostate cancer. Definition of key terms. O. phimosis, tightening of the foreskin that cannot be retracted. O. paraphimosis, foreskin that is retracted and cannot be returned to its normal position. O. balanitis, inflammation of the glans penis. O. epididymitis, inflammation of the epididymis. O. orchitis, inflammation of the testicle. O. hydrocele, fluid accumulation around the testicle. O. varicocele, enlarged veins in the scrotum. O. testicular cancer, malignant tumor of the testicle. O. prostate cancer, malignant tumor of the prostate gland. Assessment techniques: inspecting and palpating the external genitalia for abnormalities, palpating the testicles and epididymis for abnormalities, and performing a digital rectal exam to assess the prostate gland. Head, neck, and regional lymphatics assessment. Key terms: lymphadenopathy, Bruts, carotid artery, thyroid gland, jugular venous pulse, lymph nodes. Definition of key terms. O. lymphadenopathy, enlarged lymph nodes, which can indicate infection, inflammation, or cancer. O. Bruts, abnormal sounds heard over blood vessels, which can indicate narrowing or blockages. O. carotid artery, the major artery in the neck that supplies blood to the brain. O. thyroid gland, a butterfly-shaped gland located in the neck that produces hormones that regulate metabolism. O. jugular venous pulse, the pulsation of the jugular vein in the neck, which can indicate fluid status and heart function. O. lymph nodes, small, bean-shaped structures throughout the body that filter lymph fluid and help fight infections. Assessment techniques. O. inspection, observing the neck for any visible abnormalities, such as swelling or masses. O. palpation, feeling for any abnormalities in the lymph nodes, carotid artery, thyroid gland, or other structures in the neck. O. auscultation, listening for any abnormal sounds, such as bruits, over the carotid artery. O. assessment of jugular venous pulse, measuring the height of the jugular venous pulsation, which can indicate fluid status and heart function. Gastrointestinal assessment. The gastrointestinal assessment is a comprehensive evaluation of the gastrointestinal system, including the organs and structures within it. This assessment is important in detecting any abnormalities or issues that could indicate underlying conditions or diseases. Key terms: dysphagia, melena, hematemesis, ascites, jaundice, steatorrhea. Dysphagia, difficulty or discomfort in swallowing. Melena, black, tarry stools that indicate upper gastrointestinal bleeding. Hematemesis, vomiting of blood, which can be indicative of a gastrointestinal issue. Ascites, abnormal accumulation of fluid within the abdominal cavity. Jaundice, yellowing of the skin and eyes due to liver dysfunction. Steatorrhea, excess fat in the stool, which can indicate malabsorption. Assessment techniques. Inspection, examining the patient's oral cavity for any abnormalities, such as ulcers or inflammation. Auscultation, listening to bowel sounds using a stethoscope. Percussion, tapping on the abdomen to assess for changes in sound or tone, which can indicate fluid or air accumulation. Palpation, assessing for tenderness, masses, and organ enlargement. Digital rectal examination, assessing the rectum and anus for any abnormalities or issues. Guaiac test, testing for the presence of blood in the stool. A comprehensive gastrointestinal assessment is important in identifying any potential issues or conditions that may affect the patient's overall health and well-being. A healthcare provider should be notified if any abnormalities or concerning findings are identified. Abdominal assessment. The abdominal assessment is a comprehensive evaluation of the abdomen, including the organs and structures within it. This assessment is important in detecting any abnormalities, such as masses or tenderness, that could indicate underlying conditions or diseases. Key terms: distension, guarding, rebound tenderness, hepatomegaly, splenomegaly, peritonitis. Distension, swelling or enlargement of the abdomen. Guarding, the involuntary tensing of abdominal muscles due to pain or discomfort. Rebound tenderness, pain that occurs when the examiner quickly releases pressure on the abdomen. Hepatomegaly, enlargement of the liver. Splenomegaly, enlargement of the spleen. Peritonitis, inflammation of the lining of the abdominal cavity. Assessment techniques. Inspection, examining the abdomen for any visible abnormalities, such as distension or asymmetry. Auscultation, listening to bowel sounds using a stethoscope. Percussion, tapping on the abdomen to assess for changes in sound or tone, which can indicate fluid or air accumulation. Palpation, assessing for tenderness, masses, and organ enlargement. Rebound tenderness, testing for rebound tenderness by applying pressure and quickly releasing it to assess for pain. A comprehensive abdominal assessment is important in identifying any potential issues or conditions that may affect the patient's overall health and well-being. A healthcare provider should be notified if any abnormalities or concerning findings are identified. Musculoskeletal assessment. The musculoskeletal system is responsible for supporting the body's structure, allowing for movement and protecting internal organs. A thorough musculoskeletal assessment can help to identify potential issues and conditions that may affect the patient's mobility, function, and overall quality of life. Key terms: range of motion, muscle strength, joint stability, deformities, crepitus, contractures. Range of motion, the extent of movement that a joint can move through. Muscle strength, the power and force that muscles can generate. Joint stability, the ability of a joint to maintain its normal position under stress. Deformities, structural abnormalities of the bones, joints, or muscles that can affect function. Crepitus, a crunching or popping sound that occurs with movement of a joint. Contractures, a permanent shortening of a muscle or joint that restricts movement. Assessment techniques. Inspection, examining the body for any asymmetry, deformities, or muscle atrophy. Palpation, assessing the joints, muscles, and bones for tenderness, warmth, or swelling. Range of motion testing, measuring the amount of movement that a joint can perform. Muscle strength testing, evaluating the power and force that muscles can generate. Joint stability testing, assessing the ability of a joint to maintain its normal position under stress. It is important to recognize that early detection of musculoskeletal issues can prevent disability and improve the patient's quality of life. A comprehensive musculoskeletal examination is necessary to identify any potential issues and provide appropriate treatment or referral to a specialist. Respiratory system assessment. The respiratory system assessment is a comprehensive evaluation of the respiratory system, including the lungs and airways. This assessment is important in detecting any abnormalities, such as wheezing or crackles, that could indicate underlying conditions or diseases. Key terms: bronchial breath sounds, crackles, rhonchi, wheezing. Bronchial breath sounds, loud, high-pitched breath sounds heard over the trachea and larger airways. Crackles, discontinuous breath sounds that resemble the sound of popping bubble wrap. Rhonchi, low-pitched breath sounds that resemble snoring or wheezing. Wheezing, high-pitched breath sounds that indicate narrow or obstructed airways. Assessment techniques. Inspection, examining the chest for any visible abnormalities, such as asymmetry or respiratory distress. Palpation, assessing for any areas of tenderness or masses. Percussion, tapping on the chest to assess for changes in sound or tone, which can indicate fluid or air accumulation. Auscultation, listening to breath sounds using a stethoscope, including any abnormal sounds. A comprehensive respiratory system assessment is important in identifying any potential issues or conditions that may affect the patient's overall health and well-being. A healthcare provider should be notified if any abnormalities or concerning findings are identified.